Actually, no, I can. Perfect. Awesome. So, hello everyone. Thank you for joining us today. Welcome to This is Pulse, an introduction into Pulse, a web-based mobile health program and evidence-based intervention that is proven to help support healthy sexual behavior. I'm April Latt, Senior Manager for Innovation and Research here at Healthy Teen Network, and I'm joined today by Nick Safrinko, Creative Direction and Product Design Manager, and Gina Desiderio, our Communications Director. In the back is our Program Manager, Caitlin Levante, who has helped running slides. Before we get started, I wanted to set some ground rules. AI note-taking bots are not allowed per our company policy, so if your note-taking bot is removed from the call, that's why. We also ask that you keep your questions for until the end for Q&A time, and you can also type them up in the chat using the Q&A function. With that, let me thank you again for joining us today, and let's get started. Next slide, please. So, pulse check. Here is what we'll be covering in the hour so that we have together. First, we'll be giving an overview of what Pulse is before diving into its key features. Then we'll talk through how Pulse can be implemented in your community or your school. Afterwards, we'll go over pricing and next steps. Then we'll wrap up with a Q&A at the end. And again, please use the Q&A function for Zoom. That being said, are there any questions before we get started? I'll hold for a second to see if there are any questions. All right then. Okay, I'll go ahead and pass it on to my colleague Nick, who will talk about how Pulse is sex ed for real life. Take it away.
Thanks, April. As they said, at Healthy Teen Network, we like to say sex ed or Pulse is sex ed for real life. That's because Pulse is a kind of education young people can use when and where they need it most. So what makes Pulse different? Let's break it down. So over the last decade, Healthy Teen Network and our partners have developed Pulse as a sexual and reproductive health intervention with funding from the U.S. Department of Health and Human Services. Unlike many other programs, Pulse is web-based and mobile optimized, built to run smoothly on smartphones with no downloads required. Also, unlike many other programs, Pulse is completely self-led, giving young people control over when, where, and how they engage. Always sex positive and culturally and age appropriate, Pulse uses behavior change theory to educate young people on topics like birth control and pregnancy, healthy relationships, clinical services, and more. Finally, we're proud to share today that Pulse was proven effective through a randomized control trial and now stands among the teen pregnancy prevention program's evidence-based interventions with demonstrated positive outcomes. And so it's eligible for application in communities across the country. These things together is what gives Pulse its unique beat. Next slide. From the very beginning, we set out to build an intervention that puts sexual health information in the hands of young people anytime, anywhere. And according to Pew, 95% of young people today have access to a smartphone, and nearly half say they're online almost constantly. Latina and Black young people in particular report high levels of connection. Creating an intervention optimized for the phone isn't just about going where young people are spending their time. It's also about honoring how and where they're open to receiving information, especially potentially sensitive information like that on health and relationships. What's more, this approach allows us to expand our reach. While many sexual and reproductive health efforts often focused on school-age populations and often take place in schools or after-school programs, Pulse can reach older teens and young adults. By leaning into the rhythms of real life, Pulse meets young people in a space they already love and trust, right alongside YouTube, TikTok, Instagram, and Snapchat. To evaluate Pulse, we worked with our research partners at Child Trends on a gold standard study design, a two-arm randomized control trial. This rigorous evaluation was funded by the U.S. Department of Health and Human Services. So between 2016 and 2019, over 2,000 mostly Black and Latina young women ages 18 to 20 participated. These young women were recruited via social media ads, screened and consented online, and then randomized into an intervention or control group. Our goal? To see if this mobile health app can actually change knowledge, attitudes, and behaviors around sexual and reproductive health. Next slide. So, what did we learn? Well, we learned that Pulse works. First, the young people in our study liked Pulse. The vast majority of them said that Pulse was easy to use, its information was easy to understand, and was interesting. They said that they could find the answers to the real-life sexual and reproductive health questions they already had. But don't just take our word for it. Beyond the many topics it covers, one young person said that Pulse helps them know that it's okay to talk about sexual and reproductive health and ask questions in real life. Another appreciated its practicality, citing the section in the app where you could find the clinics and then visit them, of course. But beyond being user-friendly, enjoyable, and applicable to real life, you might be wondering, Nick, how else does Pulse work? Well, we'll tell you. We found that compared to the control group, the young women in our study who used Pulse had greater accurate contraception knowledge. Now, this makes sense. After all, Pulse breaks down complex information like how pregnancy happens and how birth control works into short, accessible pieces in a range of media to accommodate all sorts of learning styles. Beyond knowledge, Pulse users in our study were also more confident in their ability to use contraception in the future. This confidence may have grown from Pulse's real-life scenarios, like hearing a couple talk about condom use or seeing a peer go to their first ever sexual and reproductive health appointment. Finally, compared to the control group, Pulse users in our study were less likely to report recent sex without a long-acting or hormonal birth control method. Features like the clinic finder and reminder messages may have played a role here, making it easier to act on intentions, whether that means visiting a clinic or sticking with an effective method that works for them. Now, we can't say exactly which feature did what, but we can say that the Pulse experience as a whole helped the young people in our study feel informed, capable, and in control of their sexual health decisions. That's why we say Pulse is sex ed for real life. And that's why after assessment by the Teen Pregnancy Prevention Evidence Review, Pulse is deemed an evidence-based intervention. So with that, I'll hand things back to April. They're going to walk you through Pulse beat by beat so you could see what young people experience firsthand.
Thanks, Nick. Next slide, please. So I'm here to talk about Pulse and what it has to offer. So Pulse uses self-directed, interactive web content users can consume on their own. It shares succinct content and relatable media with humor when appropriate to convey complex health information. Pulse features a wide range of diverse media, including short live-action videos, animations, comics, audio conversations, self-assessments with tailored responses, brief texts, and interactive graphics. It also offers linkages to local sexual and reproductive health clinics and providers, as well as programmable reminders for effectively using contraception and remembering appointments. And as a fun fact, a youth advisory board helped shape the media content, and all media was reviewed by an external medical accuracy panel. Next slide, please. So now let's go over what's actually in Pulse. Pulse's content includes information that is comprehensive, culturally sensitive, LGBTQ plus sensitive, and linguistically appropriate. It addresses general knowledge on sexual health, common attitudes, social norms, and behavioral expectations, as well as helps build users basic skills in self-efficacy and contraceptive and condom use. As you'll see in the following sections, each category will have a variety of formats in which the user gets the information: guides, quizzes, videos, and even interactive comics. Each user can interact with the content that most resonates with them to learn important information. So let's explore some examples of how Pulse does that. Next slide, please. So in the section called Know Your Body, it includes interactive content to learn about anatomy and physiology. Videos from experts explain the menstrual cycle and how the body reacts to sex. Users can also take fun quizzes to help with planning and making healthy choices. Next slide. The STI section has an interactive gallery of what is and isn't an STI, as you can see here. In this section, users can learn more about each STI and other diseases, as well as treatment options in a non-stigmatizing way. Next slide, please. Through the use of storytelling in the Get Personal section, users can see different relationships modeled and are asked to choose a reaction to these scenarios, sort of like a choose your own adventure. Users can also explore multiple options in these scenarios to learn how different reactions might affect a relationship. Next slide, please. Sorry about that. My computer lagged a little bit, but in the Make a Plan section, users will find a quiz to consider if they may be pregnant, a guide on how pregnancy tests work, and a video from an expert on how a person gets pregnant. The Am I Pregnant quiz will also give users the option to use the clinic locator function to find care if needed. Okay, sorry about that. I'm back. All right. So under Know Your Options, users can take a quiz to figure out which birth control option suits them best and can read about how each contraceptive works. The guide connects to the reminder feature, which also allows users to schedule reminders to take birth control. There are also video scenarios that walk through two young people's journey on how to access birth control to help users visualize how accessing these resources in real life can play out. Next slide, please. Lastly, the clinic locator map, powered by Bedsider, can help users find clinics and providers near them. Users also have the option to set an appointment calendar reminder to make sure that they don't forget. So next slide, please. So let's see how this all works in action. Caitlin, I'm going to go ahead and borrow screen sharing from you. And I've gone ahead and turned off my camera to see if that hopefully helps with the latency. So let me go ahead and share real quickly what Pulse looks like. Alrighty. Let me see. All right, just confirming y'all can see my screen. Awesome. All right, so this is what Pulse looks like. And as a note, what you're seeing is the mobile view via a desktop browser. So some things may be wonky as it's not truly on a phone, but it gives you a pretty idea of how it would work from a user perspective. So where we are right now is what users will see when they first log in. From here, they can navigate to the various sections as they see fit. There's various carousels here where they can choose different things. We'll talk about it in a bit, but this independent user interaction journey and design is on purpose. We want users to be able to interact with the content that best resonates with them and still be able to find the information that they need to learn and feel supported. This updated user interface was inspired by the feeds young people interact with on social media every day, and content is categorized via color and icon. So for example, over here, you'll see it's yellow and a check mark. That represents a quiz. And if you look over here, audio resources have the little audio icon and they're in green. I also want to highlight over here the resources section, which, when it loads, includes links to websites and hotlines, resources from experts, and videos. So this is also available to users. And to see what Pulse is like when you're interacting with it, we can go ahead and take a little quiz. So for example, if we go to Know Your Options and we take the What's Best for Me quiz, we can see what users will go through. So here's a little disclaimer, and we can go ahead and go through the little quiz. And yeah, so this actually gave us an IUD and an implant as a suggestion for a birth control method. And actually, it'll refer you to, do you want to do a pregnancy test? And there are also other methods that it'll take you to learn more to see what it could be. I also want to show very quickly how the provider clinic locator works. So for example, you just type in a location here. I'll go ahead and say we're in Baltimore and click submit. And as you can see, there are locations all over Baltimore that we can click on. And if we zoom in a little bit, we can just go ahead and click on that. And it shows up the Planned Parenthood in Baltimore City Health Center. If you want to click over here, there's other places you can go to. It'll give you directions as well as a phone number. If you prefer to see it in a list view, that is also available to you. So this is how you can look up clinics and providers very quickly. And lastly, let's go over how reminders can work. So, for example, let's set a reminder on when we'd like to take the pill every morning. So let's go ahead and click on that. When do you want to start taking the pill? Let's say tomorrow and tomorrow morning. So if I were on a phone, if I clicked add to calendar, it would open up the calendar app, but really setting a reminder is that simple. And that's how this integration would work with calendar apps on people's phones. So that's just a really quick insight into how Pulse works. We'll go ahead and move on. Caitlin, if you can please go ahead and share your slides again. I'll go ahead and stop sharing here. Yes, cool. So now you've seen what Pulse is. Let's talk about how you do Pulse. Next slide, please. So who's Pulse for? Pulse was designed for and tested with mostly Black and Latina young women, and it was proven to be effective with that population. But that doesn't mean it can't be, but that doesn't mean it can't work more broadly. It's important to note, however, that we do not have the same rigorous evaluation for other groups. That said, we have tested a similar program with younger youth, ages 14 to 16, and found that to be effective as well. No matter who you're working with, one of Pulse's biggest strengths is that it's completely self-directed, as I shown earlier. No facilitator required. Young people can use it independently, choosing the topics that matter most to them and moving at their own pace. But that doesn't mean adults and organizations don't have a role to play. Clinics, for example, might add a QR code to their intake forms or posters so young people can explore the app while they wait. Schools might purchase access and make it available during health or PE class and use it to complement teachings in the classroom. In community or faith-based spaces, you might hold small group sessions where everyone explores the app individually and then comes together to talk about what stood out. And of course, we know that you'll think of even more creative ways to bring Pulse into your work. There's no one-size-fits-all model, but there's almost always a way in. Regardless of your setting, if you need more help on figuring out how to best implement Pulse for your community, Healthy Teen Network is available for additional support. Next slide, please. So, now where are we? We've seen what Pulse is and what Pulse does and how to do Pulse. Now I'm sure you all want to know, how do you get Pulse? And more importantly, perhaps, what does Pulse get you? So glad you asked. Let's talk about it. Next slide, please. All right, so let's talk about pricing and what you actually get when you license Pulse. I want to note that what you see on screen right now is promotional pricing for the first year of Pulse, and it's only available until the end of September 2025. Now here's the breakdown of our current pricing tiers. $5,000 for 250 users, that's $20 per seat. $10,000 for 1,000 users, that's $10 per seat. And lastly, $15,000 for 5,000 users, and that's just $3 per seat. And just as a quick note, these are unique user seats, not seats that can be swapped in and out. So for example, if you're purchasing 250 seats, that means access for up to 250 unique users across the year. Meaning, for example, two students cannot share the same login. Just want to put that out there. Okay, so what do you get with that? What do you get for your 5,000, 10,000, or 15,000? When you license Pulse, you'll receive a set of auto-generated logins and passwords that you can distribute to your users, access that is valid for 1 year, aggregated usage reports for your specific group, so you can see how young people are engaging with Pulse in your community. And of course, our team is always here to help you with onboarding and any questions along the way, with the option to add in additional technical assistance should you desire or need it. And as we look ahead, we'd really love your input. So in our feedback survey at the end of this demo, we'll ask what features or content you would like to see in Pulse going forward, what matters most to your young people in your communities, and if you're willing, we'd love for you to share those thoughts with us. And if you're interested in bringing Pulse to young people in your community, we'd love to hear from you in the feedback survey, on our interest form, or in our Q&A that's about to come up. So yeah, with that being said, let's go ahead and open it up to Q&A. We have about half an hour left together, and that time is all yours. And we're here to answer any questions that you have. This is a webinar, not a Zoom meeting, but there is a Q&A function that is available via Zoom webinar. If you look at the bottom of your screen, there's a little question mark box that says Q&A. You can type in a question there.
So, April, we got a couple questions that came in already. Gina answered some of them. I'll expand on not an anonymous attendee asked if Pulse is available in multiple languages. Gina is correct. Pulse is only available in English at
Mhm.
this time. However, Pulse was tested in Spanish as well. So at one time, we did have a Spanish language version of Pulse. And if this is something that you're interested in, I would say to get in touch with us. We'd love to explore some options there as well. April, there's also some questions about uh, the clinic locator.
Clinic locator? Yes. Yes, from Kim. Yes. How do you vet clinics for locator? Are there any mention of CPCs? So, The clinic locator uses information that is provided by Bedsider. So that's where that information is being pulled from. So as if in the future Bedsider's information is updated, that's also updated on Pulse as well. I know Gina's answering some via chat, but I just want to just to make sure everyone can hear and listen to the questions being asked. So we have a question on, does the app include information on how to access abortion pills or funds if needed? There isn't explicit information on how to access abortion funds. However, the clinic locator can be used to find providers that provide abortion. Yes. Um, Another question is there or will there be a possibility to purchase seats in smaller amounts? Yes, Gina is correct here. If the packages that we presented on the screen earlier do not fit your needs, please, please, please just reach out to us. Have a conversation. We definitely want to meet you where you are at. So yeah, just go ahead and reach out. And yes, the last question I saw was, what is the cost after the promotional period ends? Um, Beyond what we've originally set for this first year, nothing is yet set in stone. But we do want to see what the interest is for this initial year, and then we'll go from there. Any other questions? Happy to hold for a couple of minutes. In the meantime, I do see some people starting to wander off. That's totally fine. Don't want to keep you longer than you need to, but if you are planning on leaving, we very, very much would love for you to fill out a survey. And if my thing in these webinars and any calls that I have is sometimes I can't think of a question immediately, but sometimes something comes up after I've had a chance for the information to sit. If that
Well,
happens,
April,
yes.
ask and you shall receive because there are a
Oh,
couple
I see. Yeah. Okay, I see two
more.
more questions. Yes, great. Yeah. I'll get to that in a second, but if you are on the way out the door, thank you for coming. And if you have any questions, please go ahead and use the contact form that I linked here. And please, please, please fill out the feedback survey. We'd love to hear your thoughts on the information we shared today. Okay, moving on to Gina just answered another question. Let me read that out for the group. Um, yes, is there a specific contact person if you're interested in a smaller amount? Yes. Please use the form that Gina has linked and what I placed in the chat. I am the one managing Pulse, so I'll be the one reaching out to you when you fill out that form. And then there is another question. Yes. Does the purchase include a way to track numbers or other info that has been reported to funders? So yes, currently we are in the process of building out an analytics dashboard for you to report usage for whatever needs that you may have, for you to see like are users accessing it, to give you data to put in reports, etc. And as minors will be involved, this can be used in school settings or in communities. It's very privacy and data integrity is very, very important to us. So we are working that in to make sure that all the confidentiality of each individual user is protected. Keep the questions coming. This is great. Thank you.
Well, there's a question here. How will we maintain privacy of users through the seat purchasing?
I might need a little bit of elaboration on what you mean through this. But so users them, yes, I think I might need a little bit of elaboration on what you mean by this. So for the scenario we like to talk through is, for example, if schools are licensing Pulse, we don't know who the end users are. We will give you the logins and passwords to distribute among your users, and we have no way of like knowing, for example, student XYZ is associated with this login. That's handled on your end. We will not know who these people actually are. Yes.
April, the plan right now is to provide aggregate data.
Yes, yeah, it's aggregate data. Yeah, we cannot track data on an individual level. The data will be provided at aggregate to clients. Yes.
So we won't be tracking individual students' progress or whether or not they're answering questions to the quiz in a particular way. And I believe all the quizzes on Pulse are um, not necessarily correct, right, wrong answers,
Yeah.
but more about exploring and finding some birth control methods that may work for you or exploring uh, healthy relationships, your healthy relationship versus not healthy relationships.
Yes. Yeah, the quizzes are more things like there are resources that you can revisit over and over and over again. Like, for example, the quiz that we went together of like what kind of birth control method works best for us. You can take that quiz over and over again to see all the different options. See. Oh, thank you, Jessica. Jessica says this looks like an amazing tool. I hope schools get on board with it. Thank you for that. Um, I think that Nick, you answered the question about the admin side of stuff. From Lisa, is there clear and complete info on abortion services and abortion pills for users? I think we answered this a little bit earlier, but no, there is not specifically and explicitly information regarding abortion. But again, there is the clinic locator, which users can use to find access to abortion services.
What about information about consent? I believe some of the uh, Choose Your Own Adventure comics address consent, if I remember correctly, April.
Yes, there's a under Get Personal, for example. There are a series of interactive comics that talk about how, for example, like sexting can go wrong or complicated relationship dynamics. There are videos on how to know what consent is. Um, yes, so are you seeing a question that is that a question that popped up somewhere? I did not see that one, but thank you for bringing
It's in
that
the
up.
answer. Gene
Okay,
answered it, so it might be sorted there.
okay. Oh, yes. Yeah, there's content about consent. Oh, thank you, Jessica. Um, I see Gina is typing a question. Um, sorry, typing up an answer. But there's another question in here. Could you expand on how you were able to measure how effective the app was during the randomized control trial?
Yeah, we could drop a link to one of the journal articles that was written about uh, the randomized control trial of Pulse, but they looked at a number of, I think, two behavioral outcomes as well as some secondary outcomes to see how it shifted behavior between the control and the Pulse group, as well as knowledge and attitudes as well.
Yeah, I'll go ahead.
I have that pulled up. I could.
Okay, yeah. Thank you.
This is at least one of them.
I also want to lift this up in chat. Our evaluation partner Child Trends has also like aggregated all the things around Pulse. So you can look at that here. I'll post it in chat since Nick is answering it in the Q&A section. But that's also a very helpful tool. Um, I know Gina just answered one. I want to make sure I don't forget it. Yes. Will Healthy Teen Network consider adding info on abortion? That is a huge need, and I'm discouraged by this lack of info. And I just want to reiterate what Gina said here, which is we absolutely want to be able to continue to update Pulse and are committed to it. So we're trying to just, in these beginning stages, bounce the demand from the field to just have access to the app as it is right now and as an evidence-based program while continuing to update it. So patches will come down the line. And there was another question on, do you offer a live demo and or introductory trial for organizations to better determine if this tool might be beneficial for their populations? Yeah, so have a conversation with us and we can work something out on that front. We should be able to provide like temp trial access for y'all to give it a trial run to see, does this work, does this not work, beyond what you saw here today. Uh, there was a question that popped up in chat. Is this an app that will ever be available? Sorry, is this an app that will ever be available straight from an app store for anyone to download? So the big dream, the big dream is that we wish Pulse could be free. But that is unfortunately not the reality that we live in. But if we ever get our pie in the sky dream, we wish Pulse could be free. So, but as it is right now, this is how we have to distribute it to people.
Also, I would add, so Pulse is not an app.
Oh yeah, it's not
It is
app.
a web-based app, which means it's actually a website designed for mobile use, which made it more accessible and in reach for us to develop as an intervention. There's a lot more hurdles and complications with developing an app than developing a mobile website. So it is not technically an app. So that's one thing that's a major difference from something you would download from an app store.
Hmm. I also want to raise up that some of the feedback that we got in testing was it's so inconvenient to download yet another app to do another thing, whereas a lot of young people were all like, just give me a website. And so that's what Pulse meets in that particular need. It's just here's the URL, you log in, and there's Pulse, rather than having to just download another app. Any other questions? Alrighty, I do see people starting to trickle out. Um, Thank y'all again for joining. I don't want to keep you here longer than we need to. Again, I'm gonna go ahead and re-lift up yes. Thank you, Caitlin. Please fill out our feedback survey. And again, like if you want to chat, whether it's like you want to see what Pulse is more like in depth, if you want to get access to a trial, if you just want to have a conversation or ask more questions, please reach out. And we're so thankful that you were here to join us today. And yeah, I think that's everything. Anything from Nick, Gina, before we head on out and give people their time back?
Thank you all for joining. Please reach out if we can help in any way.
Cool. With that, thank y'all for joining us, and I'll go ahead and end the meeting. Thank you again.